Good afternoon and welcome to our special edition Coffee Talk Director Series, Governance in COVID-19, Key Actions for Health Provider Boards of Directors. We're pleased to have all of you join us this afternoon. And before we dive into our session, I do want to just cover a few housekeeping matters. We've unfortunately just moments before commencing the webinar today been informed by our WebEx provider that there is a potential issue on their platform with the audio of the system. We are going to proceed with the WebEx session today. And if there are audio issues, which hopefully we will have none, but if they are, we will assess at the end of the session if we're able to circulate an audio copy of the session or rerun the session. But for now, we're going to continue as planned. If you do require any technical support during the session, technical support is available online throughout the webinar. You can contact videoconference@millerthompson.com or dial 416-595-8169. It's imperative for all of our colleagues joining on the call today that you each ensure that your lines at your respective sites are muted during the session. We have muted all lines through our central control of the WebEx system and ask that you leave them that way through the duration of the session. We do have a significant number of organizations that are participating in today's session. So we will be proceeding through the webinar presentation, but will not be holding a question and answer forum at the end of the session today, just because of the sheer number of participants involved. But all of our contact information is directly on the slides, and you're welcome to reach out to me at any time with your questions. So with that housekeeping aside, let's dive into our material for today. Governance in COVID-19, Key Actions for Health Provider Boards of Directors. What is our agenda? There are 4 things that I'd like to cover with you in the hour that we have together today. The first is a quick overview of what are the COVID-19 emergency powers and orders that exist for our government, and why are they important to you as directors on boards of health service provider organizations. Second, we're going to take a brief look at the provincial emergency response structure that has been initiated across Ontario for how, as a province, all of the health service providers are responding to this pandemic crisis. Third, and importantly, we're going to talk about governance in COVID-19. How, as boards of directors, do you fulfill your roles and your responsibilities in a time of crisis? And we'll spend a good half of our session looking at very practical and proactive advice on key action items that as directors and boards you can be taking for preparedness and response. A pandemic, an epidemic that's occurring worldwide or crossing international boundaries, impacting a large number of people. In fact, on March 11th, 2020, the World Health Organization, as we know, has declared COVID-19 as a global pandemic. This is resulted in an unprecedented health crisis that is impacting every country around the world, including our own, in ways that we had never perhaps before imagined or contemplated even in our pandemic planning. The speed at which the virus is spreading will increase service demand and has the potential to overwhelm the capacity of the health system, requiring all of us as health system partners to be proactive in preparedness to be able to address the potential need. What could happen, right? There's a lot of questions being asked right now about what are we really looking at when we talk about the capacity of the healthcare system as health service providers. Well, this could mean the need for what we call surge capacity in order to be able to meet the service need if your organization can't meet the needs with the resources that it currently has. Because of the virus itself, It could mean that you have a reduced workforce in the number of healthcare workers that are available to be able to meet the needs of the patients and clients that you serve. Usual sources of supply may be disrupted in the supply chain. Staff and resources may need to be reassigned, and in fact, many of you have already begun to redeploy staff and reassign. And care protocols and practices may have to be adapted. And there are many tables on which a number of you are participating already, looking at ethical decision-making and system flow. All of these various actions that may need to be responded to during the context of a health crisis, such as COVID-19, are ones that could be undertaken independently by your organization. And that, for the most part, is what most of you are engaging in at this moment. But they may also be directed by the government where deemed necessary. What might that direction look like? Well, in the event of a pandemic, governments may invoke powers in two ways: through public health legislation and through emergency management legislation. Public health legislation includes the Health Protection and Promotion Act. Where there is an immediate risk to the health of persons in Ontario under the Health Protection and Promotion Act, orders and/or directives can be issued by either the Minister, the Chief Medical Officer of Health, or medical officers of health of local health units to any healthcare provider or healthcare entity. And those orders and directives may ask you to take or refrain from taking actions specified in an order or directive related to monitoring, investigating, and responding to a public health emergency. These can also include precautions and procedures to be followed and information that may need to be provided. Why is this important for you to know as a director on a board? Well, it's actually extremely important to you, not only as a board, but also to you personally as a director. Under the HPPA, if an entity is non-compliant with an order that has been made under this act, directors and officers can be found personally responsible of the offense, unless you are able to demonstrate that you've taken reasonable care to prevent the commission of that offense. So it's really important to you as a director and as a board in your oversight duties that you appreciate the significant role that you have to play. The same can be said for the Emergency Management and Civil Protection Act. This piece of legislation provides for orders and powers of the province when certain emergency criteria are met. The legislation includes a definition of what constitutes an emergency, and it defines it as a situation or impending situation that constitutes a danger of major proportions that can result in serious harm to persons or substantial damage to property that's caused by forces of nature, disease, or other health risks. The Lieutenant Governor and Council has the ability under this legislation, as does the Premier, to declare a state of emergency. And there's certain criteria that have to be met in order to be able to declare a state of emergency. There has to be an emergency, and we just looked at the definition of what that means, that requires immediate action to prevent, reduce, or mitigate a danger of major proportions that could result in serious harm or substantial damage. And either the resources that would normally be available to government cannot be relied upon without risk of delay, or the resources that are available are insufficient to effectively address the emergency, or it's not possible without a risk of delay to be able to ascertain whether there are resources that can be relied upon. COVID-19 has put us in a situation where the province has in fact declared a provincial state of emergency based on these criteria, and they did so on March 17th, 2020. What happens once a state of emergency is declared? What does that actually mean to all of the health service provider organizations across the continuum of care? Well, what it means to you is that the Lieutenant Governor may now make orders. Certain things are necessary and essential in order to prevent, reduce, or mitigate serious harm to persons. There's a long list of what the Lieutenant Governor may in fact do, and I've put some of those examples that I felt were most pertinent to your operations on the front lines that would be relevant to you. And they include things like establishing facilities for the care, welfare, safety, and shelter of individuals, including establishing hospitals, closing public and private buildings, such as businesses and schools, which we've seen occurring across the province, using any necessary goods, services, and resources within any part of Ontario, or procuring necessary goods, services, and resources, distributing them, and establishing centers for their distribution, and authorizing, but not requiring, any person or any person of a class of persons to render services that they are reasonably qualified to provide. So vast powers of what can occur in orders made in the context of a state of emergency. To date, actually, 8 orders have been issued related to COVID-19. One of those orders includes authorization for health service providers to redeploy staff, reassign work, change scheduling, defer or cancel vacations, absences, and other leaves, use volunteers to perform work, and provide training and education as needed to staff and volunteers. And many of you are actively engaged in these actions on the front lines already. Future orders may and likely will follow that will impact all of the health service provider organizations, and it's important for the board to be mindful of the orders that are coming forward and their impact on your organization or the flexibility that they may provide to your organization to respond to the crisis. And again, this is not only a board responsibility as governors of the organization, but through the Act, it is a responsibility that rests on the shoulders of each one of you as directors individually. Under the Act, directors and officers of an entity who fail to comply with an emergency order or interfere with or obstruct any person in the exercise of a power or the performance of a duty conferred by an order can be found personally responsible of the offense, which can result in fines of up to $500,000 and potential terms of imprisonment. So how then is our province responding? You know, they certainly have these statutory powers through which they can take action, and some of those actions have already begun. But even short of statutory powers and orders, there has been a mobilizing of provincial emergency response in order to respond to the COVID-19 crisis. And the provincial emergency response structure, and here we're talking very specifically within the healthcare system, right? I'm speaking to all of you as healthcare service providers. And there is currently a 3-tiered structure for emergency response that's operating. The Provincial Command Center, regional response tables, and then your own internal provider command systems. Ontario Health has established a provincial command center for health system oversight. And through this provincial command center, they have areas of focus that include the supply chain, data and analytics, critical care, bioethics, communications, human resources, and others. This is to be able to coordinate response and provide direction across the province at a provincial level. And it's to ensure that there will be timely decision-making in this time of crisis and timely communication and actions that are needed as a province to respond. The next tier in the response structure of the province are what are being established as regional response tables. And these tables are looking at it from a systems perspective within each region for coordination across hospitals, non-hospital service providers, and local public health units. So it's at this level of coordination that should be impacting and involving each one of your organizations as health service providers in the continuum of care. The goal here is to align health service provider activities and resources within the region and to build on developing partnerships and collaborations to enable coordinated response to this issue. Importantly, though, while the province is organizing at the provincial level, and while the regions are ensuring this cross-system coordination and communication that is essential to an effective crisis response, internally within your own organization, your organizations should, and for many of you have already, mobilized an internal crisis command system. An internal incident command system is essential to be able to effectively manage emergency operations of your organization. Generally, in your pandemic planning, you will have named a command system of this nature with focal points for emergency response, including matters like HR, clinical capacity, logistics, lab communications, and others. Now, we have a very large group of organizations participating in this session together today across the full continuum of care. Those of you that are public hospitals no doubt have your extensive pandemic plans in place and were required to do so by the Ministry of Health. But there are others of you along the continuum of care who are operating smaller service organizations that may not already have a pandemic plan or business continuity plan in place. If you don't, and you don't have something that you can just look to determine how to mobilize your command system, it is up to you at this stage to ensure that you are setting up an ad hoc incident command group and just ensuring that it covers all of the key areas of your organization that need to be able to be in constant communication and response. So this response structure that we've talked about that exists at the provincial, regional, and local level is one that is dealing with management of the crisis at the operational level. So what does that mean for the board? Beyond having the knowledge and awareness of what's occurring in the province, how do you fulfill your role and responsibilities as governors in this time of crisis? Well, the standard of care for you as directors of an organization remains the same as under the Corporations Act. Every director and officer in exercising his or her powers and discharging his or her duties to the corporation must act honestly and in good faith with a view to the best interests of the corporation and exercise the care, diligence, and skill that a reasonably prudent person would exercise in comparable circumstances. So the question becomes, when we're in the context of a global pandemic that is putting extensive pressure on our health system, what would a reasonably prudent director do in these circumstances? Now, some of you may be listening to me now and asking yourselves, is this really reasonable? We're in the middle of a pandemic health crisis. It is all hands on deck, and organizations are overwhelmed with responding to the current crisis. Is it reasonable to be concerned with matters of governance process in a time of crisis like this? And my answer to you is not only is it reasonable, but it is necessary. It is necessary because you are the governing minds of the organization and you must lead the organization through crisis. In fact, your statutory obligations demonstrate to you the importance of taking that responsibility on, not only as a board, but importantly, individually in fulfilling your personal role as directors of the organization. So the question is not whether governance should be engaged, the question is how. In a pandemic situation, we can all acknowledge, in a situation of high acuity. And in these times, traditional governance practices and processes may not be feasible. Rapid decisions will need to be made and will be required of management at times when there is not the opportunity to be able to seek formal board approval or follow board approval processes. And as we've seen with the orders and directives that we discussed earlier, government directives may in fact take away the power of boards and management to make certain decisions about how health services will be delivered and operated. But your board responsibilities of oversight of risk and crisis management remain. What you need to be mindful of is that the board oversight responsibility is one of oversight. The board and its directors should not be involved in the day-to-day operation of the providers and the frontline management of this crisis. It is natural, especially in times of difficulty, that we all want to pitch in. But it is critically important that as a board, you maintain a clear line between governance and management. This is important to you as governors, because as directors, those of you who exceed your governance role assume some risk of personal liability. You each are covered by what we call directors and officers insurance, and that insurance covers your role and responsibility and fulfillment of your role as a director. It does not cover you for management or operational activities. On the flip side, it is equally important that as governors, that you maintain the line between governance and management, because in the time of crisis, you want to ensure that you're able to empower your management team to take the actions that it needs to take to respond to the crisis in a manner that is going to meet the needs of the organization. So what then is the goal for governors? What is your goal in ensuring that you have processes and systems in place for pandemic response? And your oversight is ensuring that those processes and systems will allow a quick response to the crisis, will allow the organization and your management and operational team to quickly adapt to any increase in demands, that you have means and measures for continuity of what your provider organization identifies as its essential services, that throughout this crisis, you are able to ensure the safety of patients and staff, that you can effectively use your scarce resources, and that there are means and measures for clear and accurate internal and external communications. So how do you do that? Well, my goal for the rest of the session today is to take you through a series of practical and proactive action items that you can each take back to your board tables of how you can fulfill your role and responsibility of as directors at this stage of the health crisis that we're all experiencing. What I'd like to cover with you are board communication plans, pandemic plans and business continuity planning, frameworks for ethical decision-making, temporary appointments for professional staff, systems integration in a crisis response, enterprise risk management of new business modalities, emergency coverage for your senior officers, and how you continue to conduct your governance operations as a board through your board meetings and the quickly upcoming annual general meetings. It's quite a list. We'll dive in, but our goal at the end of this is to hope that you will have some practical action items that you can take forward. So first, I'd like to talk about board communication plans. We've talked about the role of governance in COVID-19, and the relationship that exists between the board and its management is critically important to that exercise, in each level being able to recognize its role and responsibility in functioning through this time of crisis. The board needs to be able to appreciate that it may not be able to be engaged for approval on every decision. But that doesn't mean that you are outside the phrase looking in at what's occurring at the organization. The board still has an obligation, a duty, to continue to remain knowledgeable and informed of what's happening in the organization, notwithstanding that it may empower management to take the decisions that they need to take quickly on the front lines. To do this, it's critically important that management and board establish a clean and clear process for regular scheduled briefings to the board. What is regular for your organization, what manner and approach to those briefings and when they occur will be different depending on what works best for your organization, given its size, capacity, and demands. But the key is to ensure that between board and management, that you have a clarity of understanding as to how those communications are going to proceed. And it may be that those communications will be coordinated through the chair of the board. It could be that it's coordinated through your executive committee, or for some of you who don't have an executive
Your system
committee,
volume.
you may
Yeah.
special committee may establish a special committee, establish crisis oversight. I'm sorry, some of you have unmuted your lines, and I'm going to kindly ask that you remain your lines on mute. If you do require any technical assistance, you can please contact our technical support.
Mm-hmm.
The second item that I'd like to talk about in terms of action items are pandemic plans and
I have to go.
Continuity planning. As a board, you want to be asking your organization if you have a pandemic plan, crisis management plan, or business continuity plan in place. And again, for those of you who are joining who are public hospitals, you will no doubt have these plans in place. For some of the smaller organizations, you may have plans or you may not have plans. And part of what you'll need to consider is, if you don't have one, what can you quickly get in place as an organization? And even if you do have one, do you take another look at that plan to see if it is responsive to the current crisis and situation? Things that you want to be looking for in the business and continuity plan to be able to have comfort as a board that that planning is addressing all of the key issues for the organization will be: who will make decisions and what criteria will they use to make those decisions? What health and safety measures will be taken to protect staff, patients, and clients? How will the supply chain for essential goods and services be maintained? When and how will you communicate, both internally and externally? How will your critical business functions be maintained? What are non-essential to you as an organization among your services? And which of those services can be suspended or postponed for a period of time? And if you must close your doors, which, as we know, for many businesses across the continuum of care, other than those who are in acute care delivery, it has resulted in a closure of some of the doors of your service. How do you have access to critical organizational information that you require in order to be able to continue to serve your patients and clients in new and different ways? The pandemic plan is complemented by what we call a framework for ethical decision making. It's a framework that most in the health sector hope we don't have to use, but one that guides decision making during these times of crisis where there are scarce resources or impacts on our ability to service patients or clients in the manner in which we typically would. So as a board, on your checklist of items to ask is also whether your organization has a framework for ethical decision-making. A framework that will guide the organization in making difficult decisions about which services will be provided, how services will be provided, and how limited resources may be used. Where a systems approach is required to respond effectively to a crisis situation, as is certainly the case here, and as is seen by the significant amount of work and dialogue that's beginning to occur across regional tables, it may be helpful and at times necessary to harmonize your ethical frameworks for decision-making to support more coordinated response across the system within your region. Everyone really needs to be on the same page in terms of system and process of how services will be delivered and how they will be accessed. Many organizations have access to a bioethicist, and if your organization does not, there will be other system partners that will potentially be able to extend this support to you. And what a bioethicist does is that they can be accessed as a resource to support you in the application of ethical framework decision-making in specific situations or matters that your organization is considering, if your organization requires such support. I'd like to pivot now to talking a little bit about temporary appointments of professional staff. And I appreciate here that I am speaking in part here directly to all of my public hospital colleagues around the need to build up resources and access resources during this time of crisis. But it's important that those of you who have procedures for credentialing and review and appointment of professional staff, that you are clear on how you will manage that professional staff and bring in additional resources as needed. What is important is that you confirm your bylaws, policies, terms, and processes that are in place currently to allow your CEO or your chief of staff authority to grant those temporary appointments, be they to physicians, registered nurses in the extended class, or others to meet your human resource needs. You don't want to be waiting until that moment when you need to engage temporary staff to be trying to figure out these processes and ensure that you have the necessary in place. So it's important that you are proactive as a board and an organization to confirming what terms and processes have already been established with the organization that now need to be mobilized at this time to enable such temporary appointments. When I talk about temporary appointments, I'm talking about both expanding the scope of appointments of existing staff or also bringing in new professional staff into the organization. Now, generally, temporary appointments are a time-limited exercise, and they are made on an urgent basis, but are made subject to MAC and board approval. So there is a continuing role for the board as it relates to professional staff appointment and oversight. And I want to flag for you that notwithstanding that we're in a crisis situation where you need to move quickly, urgent situations still do require that you engage in the appropriate due diligence about staff that you are bringing into the organization at a minimum in terms of their licensure and their professional liability protection that is in place. Now, it may be possible to rely on the credentialing that's been completed by others, and I'm not suggesting that this should be a barrier to bringing individuals into the facility, but the standard of care and the level of care that the organization delivers, the manner of quality of care, are all still matters that are important to the organization from a risk and liability perspective. And so you want to ensure that although you are moving quickly that you are still moving prudently and ensuring the appropriate due diligence. What I recommend also is that while we are in this preparedness phase, now no doubt we are well into response to COVID-19, but we are preparing for a surge that hopefully won't happen. But if it does, you want to be able to act promptly and quickly at that time. So while we have the ability now, it is important to look at preparing things like advanced forms of letters of temporary appointment and other documentation that supports a temporary appointment process that you can deploy very quickly at the time that you require it. And bringing in staff, whether they be through temporary appointment of professional staff or looking at organizations who are potentially currently servicing more than one health service provider along the continuum of care, will require a systems response. And so part of that as well is having an eye as a board on a systems perspective of where your organization fits in terms of how it will access and engage resources and engage with other partners. The Provincial Command Center, the regional response tables are all examples of how the systems perspective and approach is being brought to the pandemic response. But at your own provider level, taking that systems perspective will also require you to engage with your other health service providers, as well as other community partners. So this may involve looking at things like an additional service sites with community partners, be they with hotels, schools, or event spaces that could be converted or used for the delivery of care. Looking at system protocols, as we look back to what we were discussing a minute ago about ethical frameworks for decision-making and harmonization of those frameworks and thought processes across partners that you may have in the continuum of care, one could develop system protocols for location and transfer of patients and clients based on their need and based on the capacity of the system. So it will require you in determining your planning, not only to be looking inward, but to be looking at the movement of your patients and clients across the system and coordinating that with the decision-making of your health partners. Human resource allocation will be another critical factor that as time proceeds will require close attention, especially as we begin talking about the challenges of containing spread, where we have in some communities human resources that are being engaged and provide service for more than one health service provider in the continuum. And what may and will likely occur will be a need to engage in those systems discussions to determine where those resources are best placed and may require assignment to one health service provider only. All of this will require dialogue at a systems level, including contingency agreements or arrangements that you may have within the system or with private sector partners for the supplies and equipment that you may require. Creative solutions are, of course, encouraged, and our province is actively looking at a variety of creative solutions, as are many of you locally. And our key message to you here is that while creative solutions are invited and are in fact likely necessary, they still need to be risk assessed. And so from a board perspective, from a board oversight perspective in crisis management, you want to ensure that initiatives that are being undertaken, creative solutions that are being identified, that the organization has looked at those still from an enterprise risk perspective and is able to implement those in a way that will mitigate and manage risk to the organization, not only in the short term, but also in the longer term when we come out of this exercise on the other end. How do you do that? At least at a minimum level, ensuring some basic documentation of respective roles and responsibilities that are being undertaken so that one can then also identify allocation of risk and liability for services rendered. And we all hope in these times of crisis, that everyone is working together towards a common cause. But as we've seen from previous crises that have been experienced by our province, SARS, H1N1, there is inevitably at the end of that crisis journey, often a response of certain amounts of risk and litigation that occurs relating to services that were delivered or actions that were taken. And you want to ensure that as you are moving through these steps and stages as an organization quickly, that you're still doing it in a risk managed way so that in the longer term, you're able to point to the protocols, processes that you've followed, and the clarification of roles and responsibilities that you obtained. That lends itself, to our discussion of the various new business modalities that you may introduce in the manner in which you're delivering services. This may be more relevant to those of you who are participating on the line that are engaged along the continuum of care, where you have direct interaction with individuals in the community in delivering your services, be they home care, mental health and addiction supports, supports for children and youth, as well as for our seniors communities. And by necessity, the circumstances that we find ourselves in is requiring some of that creativity of thought, not only in how we work with our system partners, but also how we operate as health service providers in this new normal. And part of that is exploring new business modalities. And certainly the one that has been most common and that has already well in implementation across the province is the use of different modalities for the delivery of telehealth services and other forms of remote engagement of health and social service support. Now, most, if not all, of the regulatory health colleges have been very active and prompt in being able to provide direction to their regulated health professionals on the engagement of telehealth services, with guidance as to how to implement services and engage in them. But the operation of telehealth services and other modalities of remote delivery of service carry the same risks with them as they did before COVID-19, right? This has not impacted any change to the laws and the environment in which we deliver services through these electronic modalities. And so while we're implementing these new business modalities, it's really important that you take an enterprise risk lens to how you are doing them. Again, not to hinder or overly complicate your implementation of the delivery of these new modalities of service, but to ensure that they are being approached in a risk managed way, to ensure that both in the short and longer term, that the best interests of the organization have been considered and reflected in the parameters and operation of these telehealth services. So a key example of that, of course, is in respect of privacy of personal health information and cyber risk. Those are matters that continue to remain, and one needs to be mindful of measures that are being put in place to address privacy and confidentiality of information and to safeguard against the potential risks of privacy breach. And to do that, you want to look at basic risk mitigation measures of putting in appropriate policies, consents, and terms and conditions of use. And many of these things here that I'm suggesting are forward-facing documents that you would be using in engaging with clients and members of the public in delivering these services, so that it is clear to them what the risks and parameters of the service are, and that you ensure that you've risk protected your own organization in engaging in these new forms of business. Emergency coverage for senior officers. This is something that is critically important and really needs to be looked at across both the management as well as the board. Most of you should have plans in place for emergency coverage for your most senior officers, such as the Chief Executive Officer, Executive Director, and or your Chief of Staff for those public hospitals that have joined us today. What these emergency coverage plans do, and these would be ones that the board would have clear oversight over, they address who would assume the role if there's a sudden need. They would address the risk management contingency plan that is in place to ensure the quick and appropriate succession. And one can pre-approve what this plan is and what that emergency coverage will look like if your senior officers are in a position where they're not able to act, and enable that to be implemented quickly. For those of you who haven't pre-approved plans of that nature, you can also just establish governance processes that would enable you to move swiftly should you need to in order to be able to act. My message here to you is just to be conscious about it and to either confirm for yourselves as a board what are your current policies that are in place that you may need to mobilize on quickly, educate yourself on them, and if you don't have them, then set in place a process that you will follow so that if needed, you can act quickly. Again, advanced preparation is key while we still have some time to be able to engage in that, to the extent that your comm staff can prepare advanced communications that you can keep at the ready for quick release in the event that you need to make an emergency coverage switch among your senior team. That will ensure and be able to maintain stability for your organization. This is important not only at the management level. Often when we talk about emergency coverage, we are talking about it at the level of senior management. But I want to impress upon all of you, as today we're having a discussion about governance, that this is equally important for your board table and something that we don't often talk about at the board beyond the roles of the board chair and vice chair. Now, many of you will have a vice chair who will step into the shoes of the board chair should the board chair not be able to fulfill his or her duties. But there are, and I've looked at bylaws before that don't have an office of vice chair. So it's really important that as boards, I want all of you to go back and just confirm in your own governance documents what are the officer responsibilities and succession that are provided for in either your bylaws or your policies. You could look in both places. And if you don't find anything in there that's clear as to the point, this would be the time to, at your board table, action this as an item to ensure that as the directing mind of the organization, that you're able to continue to function seamlessly during this time. And as we talk about functioning seamlessly, last but not least in our discussion together this afternoon, I want to talk about board meetings and annual general meetings, because as a board, you do need to continue to operate your board table as you always have. You are the leading mind of the organization and you have continuing governance responsibilities. What does that mean? I mean, the COVID-19 pandemic hopefully will not, but may continue for some time. And so as a corporation, you still need to be able to continue to engage in regular board and committee meetings. You may need to convene special meetings of your board. You may need to call executive committee meetings to deal with urgent matters. And most, if not all of you, will have upcoming annual general meetings of the members that you'll also need to begin to turn your mind to. It's highly recommended that you do seek the support of an advisor in confirming and settling what your protocols are under your internal governance documents for conducting board, executive committee, and members meetings during this time of the pandemic, given the various restrictions that are in place on being able to conduct meetings in person, and as well the needs that may arise to be able to hold and conduct meetings in very short order. And so in respect of board meetings, what the Corporations Act provides is that unless the bylaws of your organization say otherwise, and I have seen bylaws that do say otherwise, so it's important to have that caveat here. If all of the directors of a corporation present at or participating in the meeting consent, the meeting of the directors or a committee may be held by such telephone, electronic, or other communication facilities that will permit all persons participating in the meeting to communicate with each other simultaneously and instantaneously. Now, most boards already have practices for engaging in electronic meetings. There are some boards that I have worked with that do have governing documents that indicate that the priority is the conducting of in-person without other approval by the board or the board chair. And so you do want to, as a due diligence item as a board for your own proceedings, look at your bylaws and policies to ensure that you have the ability to have meetings by way of electronic means, and what are the parameters around how you conduct those meetings. And as well, holding an electronic meeting is the same as holding an in-person board meeting. All of the same governance and rules and processes apply to you under your bylaws and your policies unless you've provided otherwise or determined otherwise as a board. So you want to also be looking at things like, what are meeting notice requirements? What are requirements in your policies, for example, around the distribution of meeting materials, and what options might be available to you to be able to use alternate means for all of your directors to access the necessary materials and to participate in the meeting. So when I'm talking about that, I'm talking more generally just about your general board meeting schedule, where most of you are meeting either every month or every other month to conduct your regular board business. But in a time of crisis, you may also need to convene your board quickly on the matters that are very relevant to this crisis to take swift action, which could be on a variety of things, a number of which we've talked about today in our key action items list, and when we talked about what can happen from a statutory orders and directive perspective. A key question for each of you to be asking yourselves is, do you have an executive committee? Not all boards have constituted an executive committee. Not all boards are able to. There's certain restrictions on the Corporations Act as to whether you're permitted to have an executive committee, depending on the number of your directors. Where you have an executive committee, it's important that you, at this time, as a preparatory due diligence measure, be proactive in taking a look at your terms of reference as to how and when your executive committee can be convened. It is not uncommon for executive committee terms of reference to indicate that the executive committee can be convened only in circumstances where you have attempted to convene the full board but have been unable to do so. And so it's really important, when you need to act swiftly, that you understand clearly what are the rules of your own internal process in convening your EC. You also want to look at what procedures are mandated within your bylaws and your policies to be able to call special meetings of the full board, should you need or be mandated by your governance processes to convene the full board in order to be able to respond in the crisis situation. So again, the goal here is advanced preparedness, so that in the event that you need to move into action in responding, you can do so quickly and you know exactly the steps and process as a board that you need to follow. Last, but certainly not least, as we close off our discussion together today, I want to spend a minute talking about the annual general meeting. Under the Corporations Act, an AGM is to be held more than 15 months after the holding of the last preceding annual meeting. We are heading in very shortly into AGM season, And so it is important as boards that you begin to look at what your options might be for conducting the annual general meeting of your organization. This may be impacted by whether or not your corporation has what we call an open or closed membership. When I say open membership, I mean that you may have a large membership that includes members of the public. In a closed membership model is where organizations have members who are also the same as the directors on the board. So whether you have an open, closed membership or some hybrid of the two, it will be important to consider what options are best suited to your organization to be able to conduct your AGM. Similar to board meetings, the Corporations Act was in recent years amended to allow members' meetings to be held by telephone or other electronic means, again, unless the bylaws provide otherwise. And so you want to consider carefully what are options that are available to you under your existing governing documents and the Corporations Act, reading them jointly, for how you may conduct a members' meeting. And then, of course, considering from a more practical perspective, what, even if permitted, will be feasible in terms of holding your AGM. I will flag for you here that if your AGM is not held at the proper time, the Corporations Act does contemplate that and indicates that directors will continue in office until their successors are elected. We have covered a lot of material together in the hour that we have spent, and we do hope that this material is helpful to you in being able to take proactive measures in responding as a board. As some final thoughts, boards can be proactive in this time of crisis, fulfilling your oversight duties so that you can ensure your preparedness, the preparedness not only of your board table, but of your organization and management team as a whole. While boards do need to be engaged during times of crisis as leaders, you also need to be mindful that what you follow typically as governance processes and measures may not be feasible in this time where we need to be able to act rapidly. And so you want to be engaged as a board, but you also want to do so in a manner that will enable the most effective crisis response for your organization. It is imperative as boards and as directors that you stay informed of the latest updates of what is occurring in respect of the crisis, including importantly as to directions and orders that are being released and directed by the government, because importantly of the responsibility of your board, but also of each of you individually under such legislation as directors to ensure appropriate compliance. It is critically important during this time that board and management are functioning in a manner that is coordinated. And you should agree on what is a system of regular communication that works best for your organization. There's no one size fits all, and what works for one organization may not for another. The key is just to ensure that within the organization that you're functioning as a unit. And last, but certainly not least, boards need to look at your own governance processes. This is not just about how the organization is going to respond. It's also about how your board will respond and function in its leadership duties during this time. And it behooves all of you to take a look at your governance processes and procedures to ensure that as the directing minds of organizations, that you can continue to provide seamless operation and oversight. We thank you all very much for joining our session today. Miller Thomson continues to remain available through our on-call service and all of our professionals to be able to support your organization during this time. Do feel free to reach out to us with any questions that you may have, and wishing everyone to stay well. Thank you.